Assalamu alaikum everyone, welcome back to the channel Unani Medico. So this is part 2 of the lecture general physical examination. In last video lecture we have discussed till cyanosis and the next topic will be clubbing. So what is clubbing? Clubbing means the bulbous enlargement of the nail beds, of the soft parts of the nail beds and the fingertips, and they resemble the drumstick appearance. So there are some diseases in which the fingertips become enlarged and swollen and the angle between the two nail beds is lost. Okay, so in this there's a shamrod sign in normal individuals. When they put together the two thumbs together, it forms an angle, but in cases of clubbing that angle disappears and this is known as the shamrod signs. And there are various grades of clubbing. So in normal fingertip, the nail joins the fingertip at an angle, but if clubbing is present at grade 1, the nail becomes fluctuant than normal. In grade 2, there is obliteration of the angle more than normal. And then in grade 3, when we talk about the grade 3, so in this there is bulbous appearance of the fingertips, and in grade 4 the fingertips resembles the same as in grade 3. They are enlarged, bulbous enlargement is seen, but it is also accompanied by the painful thickenings. So grades of clubbing is an important topic. It has been frequently asked in the previous question papers. Then after the clubbing we will see abnormalities in nails. There are certain abnormalities which we can appreciate to diagnose a certain disease. In this, first is the koilonychia. Koilonychia, it is due to thinning and the softening of the nail plate and resulting in the spoon-shaped nails. So whenever you see the spoon-shaped nails or a kind of abnormality like this, the causes may be the iron deficiency, anemia, porphyria, Raynaud's disease, or occupational diseases. Second is the BUMS line. There are transverse ridges or lines that are present on the nail plate due to alteration of the nail growth rate, and its causes are pneumonia, MI, or drug reaction. So these abnormalities in nails, they help to make a particular diagnosis. Then comes the edema. So edema is characterized by the accumulation of fluid in the interstitial spaces, as you all know. So certain position and sites of edema signifies different diseases. It may be generalized or localized. When the edema is present on the full body, it is termed as generalized edema, and when it is present on certain part of a body, it is called localized edema. When there is generalized edema, it is also known as anasarca, and it is due to the accumulation of fluid in all over the body. But if there is accumulation of fluid in localized sites, such as in legs, or such as in that is in periorbital edema, it signifies nephritic syndrome. In leg, it signifies any renal diseases. In left hand, it signifies left ventricular failure. So there are certain spaces that signifies a disease, and you can make a particular diagnosis. So edema is also a very important topic, and the site of edema has been asked in question paper, and types of edema is also asked been, or a general introduction of edema is also been asked in the question paper. So I have mistakenly missed this slide, so I'll continue this from here. White nail, red nail, blue nail. So white nail is characterized by the white color in the nail bed than in the nail plate, and it can be caused due to anemia, hypoalbuminemia, diabetes mellitus, rheumatoid arthritis. Red nail can be indicative of the congestive heart failure. Blue nail can indicate Wilson's disease and silver deposits. Black nail can help to make the diagnosis of Cushing's syndrome or Addison's disease. Yellow nail is characterized by yellow finger and mostly jaundice. Okay. So after edema, there is lymphadenopathy. In lymphadenopathy, there is enlargement of the lymph nodes. So there are around 400 to 500 lymph nodes in the body, and they are normally palpable as small nodular tenderness of less than 0.5 centimeter. But if they are enlarged, they indicate a certain disease, and it is termed as lymphadenopathy. In several diseases, pathologically, the lymph nodes become palpable and visible as well. For example, in tonsillitis and tuberculosis. Then comes the vital signs. So vital signs include the four things: the pulse rate, the respiratory rate, the blood pressure, and the uh, temperature of the body. So pulse, the radial pulse is palpated, and its rate, rhythm, and character should be noted. So the radial pulse is palpated with the tip of three fingers of left hand, with the wrist slightly flexed and supported by the right hand to relax the muscles. So keep in mind that the pulse is always taken with the help of three fingers of the left hand. Then comes the respiratory rate. It is counted by watching the movement of the abdomen, and there are two cases, the tachypnea and bradypnea. tachypnea. Tachypnea when the respiratory rate is increased, and bradypnea when the respiratory rate is decreased. So these two cases helps to make a diagnosis of the disease. And the normal respiratory rate of a normal individual is about 16 to 20 beats per minute. Then comes the blood pressure. So it is estimated with the help of sphygmomanometer. So there are various types of sphygmomanometer, the digital one, the mercury. So the most accurate is being considered as the mercury type of sphygmomanometer, and the normal value is 120 by 80 mm of Hg. Then temperature, it is recorded by the help of thermometer, and the normal body temperature is 37 degrees Celsius. Now there are some diseases that can be identified by just looking at the face of the patient. So there are some characteristic features such as an acromegalic face. It indicates a prominent lower jaw, the coarse feature, large nose, lips, ears, prominent head and cheeks bone with widespread teeth. In Cushing syndrome, the face is rounded. It is a type of moon face with excessive hair growth. In hyperthyroid face, the face is anxious with widely opened eyes. It gives an alert appearance. The patient looks to be very alert with widely opened eyes associated with infrequent blinking and absence of wrinkling on the forehead. Hypothyroid face, there is puffy face with dull expression with swollen eyelids and loss of hair over eyebrows. The leonine faces. In leprosy, there are presence of leonine faces. They show thickening and earlobes with flattened nasal bridges and loss of hair on lateral aspect of eyebrows and eyelashes. So in hypothyroid face, there is absence of hair over the eyebrows, but in leonine faces, the hair is absent on the lateral aspect of the eyebrows and eyelashes are included as well. So this was all about the general physical examination. I conclude this lecture here. So if you like the video, then please do like, share and subscribe the channel, and thank you for watching the video.